My wrist presentation was over Madelung's deformity. With anatomy, we're going to be looking at the ulnar and volar tilt of the distal radial surface. When looking at the ulnar, we're going to be looking at watching if it's normal growth, and then also whether it subluxes dorsally, and then the lunate. It's going to be characterized with malformed wrist. This can be unilateral or bilaterally seen. It's mostly seen unilaterally. It can be associated with Larry wheel, which is a genetic disorder in which dwarfism is shown. You can also see short forearms and short legs. With these short forearms and short legs at the elbows and at the knees, you'll see a bayonet form or the bowing. Pathology, there's two. The first one is just disruption, or it can be known as repetitive trauma. So the volar epiphysis of the ulnar and the distal radius will be displaced. The second one is the tethering of the Vickers ligament, which can also be known as the radiolunate ligament, and it can be paired with the palmar radiotricrucial ligament, so connecting all those bones together. Mechanism of injury, there's three. The first one is just a basic condition in which there's an abnormal growth plate, and then it also, with that, is going to be a abnormal ligament connecting. The second one is going to be a gene mutation, which would be the Shoke's homeobox gene, which is seen on the X chromosome of girls and women. And then the third would be a direct correlation or association with both Larry wheel, which was priorly talked about, and then also Turner syndrome, which is shown in the photograph. People with Turner syndrome will suffer from hyperthyroidism, a wide chest, infertility, numerous moles, problems in the lymph system, swollen hands or feet, cardiac problems, short or wide neck, small jaw bones, and then low set ears. Signs and symptoms, beginning with signs. Most signs and symptoms will be asymptomatic until adolescence, but protrusion of the distal end of the ulna, fracture of the distal end of the radius, and this will be shown with an upward displacement, and then a complete dislocation of the inferior radio-ulnar joint with marked ulnar deviation of the hand, which is photographed. Symptoms, they're going to see ulnar impaction, the median nerve irritation, congenital subluxation or dislocation of the ulnar's distal end. This is going to be due to increased inflammation within the wrist, and then typical pain and loss of range of motion. Looking at differential diagnosis, this can be caused with trauma, so thinking more of a fracture or growth plate fracture, especially seen with adolescents, and then possible infection as well. And the last couple is going to be Turner syndrome, skeletal dysplasias, Ollier disease, which is pictured, and then hereditary multiple exotosis. Looking at special tests, there are no special tests for Madelung'S deformity, but the condition is usually diagnosed through physical examination between the ages of 8 and 14 years old, and then most physicians will require x-rays and/or genetic testing to confirm the diagnosis. Looking at predisposing factors, the only couple that can be are genetic complications or conditions, and then also women are more prone to this than men with a 4-to-1 ratio. Management and treatment, looking at operative, which are the most common treatments. There's a couple. Can do an ostomy, which is taking away some bone to reduce pain and inflammation and whatnot. And then another one would be just the release of the Vickers ligament, so cutting that completely. And then the last one would be in arthroplasty, in which they would add in a couple screws and a plate to help with the deviation that would be occurring. Looking at non-operative, which these are rare, but restrict the weight-bearing activities until the pain subsides or decreases. NSAIDs, and then also a splint or brace to assist in arm deviation. You can also do this with taping if this is a mild case. Looking at referral and immobilization, if Madelung'S deformity is suspected during physical examination, referral to an orthopedic or hand and wrist specialist for further consult will be completed. Splints and braces can be a form of treatment, but most cases will require a surgical fix and possible screws, plates to assist the deviation of the affected bones, like shown prior in the slideshows. Looking at prevention, there is no way to prevent it considering that most of the things are going to come from a genetic or trauma incident. There is no mulligan. And then looking at my PCOT, I chose more of a rare form of Madelung's, but it's from a 21-year-old female collegiate gymnast with acute left wrist pain. Intervention was symptomatic therapeutic modalities and NSAID for pain. So looking at the non-operative side of things, they minimally restricted movements and then used tape to prevent end range wrist extension. And this is compared to not doing anything and just allowing her to compete with the pain. And the outcome was the athlete with the therapeutic modalities was able to compete and successfully complete her season. The time was over the course of the competition year. There's a reference.